By and large, the active duty population is healthier compared to the rest of the general population in America. We all know this is one of the nature of the career fields that we're in, or can be very physical. We have structured time every day for fitness. Certainly in the Army we did. In the veteran population, though, that changes, where the structure leaves us the accountability of things like PT tests, height and weight standards, 20-mile foot marches go away. And during that transitionary time, and as a veteran, our fitness levels, especially in terms of metabolic disease, are typically worse than the civilian population in the United States. In this episode, we'll talk about what some of those causes are, what that looks like, and what you can do to help prevent it. Metabolic syndrome is a constellation of disease states that all kind of fall under this umbrella of metabolic syndrome. This includes things like obesity, where you might have a BMI greater than 30, a BMI over 25 is overweight, 30 is obese. Insulin resistance can be an elevated A1C, and there can be insulin resistance, which kind of is the precursor to full-blown diabetes. The second is another element is high blood pressure, high cholesterol, and fatty liver disease, which is rapidly becoming one of the number one causes of liver failure in the United States. That is liver disease that is not caused by drinking. The liver gets fibrosed and harder and can't function as a filter like it typically would. In the active duty population, this is about 23% of active duty service members have some form of metabolic disease, compared to the kind of larger population in the United States, which is almost 40%. And then after separation, those veteran rates get up over 40%. The number I was looking at, I think the VA was advertising, was closer to 43 or 44%. This type of metabolic syndrome puts us at risk for things like heart disease, with having high triglyceride levels. It leads to increased plaque formation in our arteries, in our heart, in our blood vessels, increasing our risk for stroke. Kidney disease from diabetes. The uncontrolled sugars in our blood affect all the small vessels around in our eyes and our kidneys and elsewhere in our bodies. And this syndrome starts to take off dramatically after we separate. One of the causes, I think, is because we might transition from being very active. Maybe you were an infantryman or something like this, and you transition into working as a forklift driver, something in a warehouse. And certainly the change in intensity and physical activity of the job that you went from to where you currently are doesn't really, set yourself up to be as active and have that hour and a half of PT every morning to do. And the other thing that happens too, I see a lot of veterans get in this, is we get in this cycle of kind of injury and chronic pain, where, let's say you were on jump status, you hurt your back and your knees, you got out of active duty, and now you're not able to, run and lift the way you might want to because of the pain. Now you start putting weight on, and the pain gets worse, and then, maybe you popped a disc in your back, and the back surgeon says, "Oh, I'm not going to do surgery to help your disc until you lose the weight," which is kind of the genesis of the whole struggle that you're going through. And that's certainly frustrating. And then that, worsens depression and PTSD symptoms, like we've talked about in previous episodes. And ultimately, kind of one of the statistics I saw that was kind of scary was from the VA, was within about 7 years of separation, veteran obesity rates go from 14 to 32%, and just obesity alone, not including all the other kind of subcomponents of metabolic syndrome. As I kind of alluded to before, one of the primary problems, or the primary causes of metabolic syndrome, is obesity. And I want to look up that number here, and it's 42.6% of veterans versus 33.7% in non-veterans. with just male veterans in particular. And this increases our visceral fat content. So that is kind of the fat that's packed around our organs and around our midsection. It leads to things like getting an increased neck circumference and sleep apnea and things like this that we've kind of discussed in other episodes. And again, it creates kind of a cycle where now your sleep gets disrupted from the sleep apnea you got from putting a little extra weight on, to exacerbating maybe your PTSD symptoms and not sleeping. And it is yet another kind of cycle we can find ourselves in. The other element is type 2 diabetes. So you have type 1 and type 2 diabetes. Type 1 diabetes is largely, kind of the destruction of the pancreas's ability itself to kind of make insulin. Type 2 diabetes is where you can start to develop the insulin resistance, so that it's your body's ability to use insulin, the hormone insulin, to pull sugar into the cells. And it creates a demand on your body to then have the pancreas make more insulin. So those cells are working harder to produce more, to get more insulin into your body, to get the sugar out of your blood into your cells. Well, the problem with that is those cells start to burn out over time. So you have kind of a burnout of the islet cells within the pancreas itself, and then the need for extra insulin in your body to get that sugar pulled in, which is what basically type 2 diabetes is. Interestingly, one of the pathways that you can do to get sugar out of your blood into your muscles faster that doesn't use insulin is through exercise, especially aerobic exercise, which can help to kind of pull that sugar directly into the muscles for use when it's demanded, but it doesn't happen just at rest. The other kind of piece to this is hypertension. Again, can be driven by diabetes. And we can also see this with alcohol misuse, where folks are drinking, causing spikes in their blood pressure, which causes their heart to have to work harder, which pushes them at risk for cardiac disease and stroke and kidney disease, which the consequences of are not going to be readily apparent when you're, let's say you did 6 years and you did 18 to 24. You're not going to necessarily notice that until you're maybe in your 40s and 50s, and then that lifestyle deficit is going to start to catch up. And as I mentioned before, the other kind of interesting aspect of, or maybe not interesting, so not the best word to use, is non-alcoholic fatty liver disease. You'll see it called NASH, NASH, or NAFLD. And this is kind of liver dysfunction that's a result of just fat being packed in the organ itself. And the liver is kind of spongy. A healthy liver is very spongy, and blood kind of flows through it. And it's kind of this natural filtration process to get toxins out of our body and process our blood. But when the liver starts to get fibrosed and thickened, that process starts to get slowed down. And I am anecdotally at work seeing much more of this with veterans who may not be liver on the transplant list for liver failure from alcohol misuse, but from fatty liver disease. And that is a horrible disease to have. I don't wish that on anybody. These folks have to come in when it's very advanced and have needles put in their belly to have fluid drained off intermittently, and it's got to be a tough way to live. So what actually works? It's common sense stuff that I don't think is going to surprise too many of you. One is doing something for yourself. You got to do some exercise. And certainly as you're getting older, out of your 20s and 30s, as your testosterone levels start to go down, your lean muscle mass drops. Doing resistance training and cardio training is important. I think as you get older, certainly into your 50s and 60s, the importance of strength training probably becomes even more important to build that lean muscle mass so that you can be functionally healthy in an older age, so you can be able to get yourself up off the floor. If you're laying down flat, you can take care of yourself and get around town and not have to depend on others. And as I alluded to earlier, by doing, having and adhering to some type of exercise program, It improves your insulin sensitivity. It gets those blood vessels to work out and expand and maintain some level of pliability to help with your blood pressure. And also, it's just you're going to feel better. You get that dopamine release and start to feel a little better. Getting some of that weight off is going to help improve your sleep and work on that sleep apnea. Maybe you can graduate off the CPAP. Maybe you don't need to be on the CPAP if you can get some extra weight off your body. You don't have to tote that little bag around at the airport. And then kind of the third or another element here would be nutrition. I feel like this can be a loaded gun now. There's a lot of tribalism, it sounds like, around nutrition. I would recommend, depending on what your circumstances are, and you can certainly use the VA and be seen by a nutritionalist, but to at least get a sense of what kind of your macro needs are, what your protein, your carbs, and your fat needs are, your sugars, so that you can kind of maybe track and journal and see what you're doing there, but being sure that you're eating real foods, you're staying away from super high processed stuff. And again, that's really easy to say if you're struggling and living paycheck to paycheck. That's maybe a lot harder to do than someone who's not having to struggle that way. But I want to encourage you to be able to try and get yourself some real food and some real nutrition. The VA certainly has resources. If you don't like to use the VA, you can get a community care consult, be seen in the community, talk to a nutritionalist. Sometime, I'm not 100% sure, but I think you can probably also maybe get in and see an exercise guy or talk to a physical therapist, again, either through the VA or in the community, to start to get on some type of training program. I know the VA has a couple, they have like the MOVE program and some other ones I've seen. The reactions I get to talking to some of the veterans are mixed. So it sounds like some facilities might be a lot better fit than others. But I think doing anything is taking a step in the right direction. And I would encourage you to not just kind of sit tight and just kind of think about the things that you want to do, but to pick one of these things and kind of focus on it. There's, of course, medical management. There's all kinds of pills and drugs I can throw at you. But I mean, the reality is food, sleep, exercise is kind of the foundation of all of this. I can throw metformin at you for your blood sugar. I can throw Crestor at you. And if we need to do that, we will, to help kind of protect yourself and keep you safe. But getting that weight off, sleeping, improving that insulin sensitivity can get you to a point where you might not need medication, even if it's just on a trial period. And then also they have the new medications, the GLP-1s, the Ozempic, the semaglutide, semaglutide. Those type of medications. Rybelsus is an oral pill now that you can take. That can help with your weight loss and your diabetes. It's cut in the VA formulary. I would make sure that you're having a good talk with your team and where you are in your life. If you're 30 years old, the discussion is probably going to look a little different than someone who's 60 and has just come out of the hospital for a bypass. So the treatment plan needs to be tailored. Your whatever medical choices you want need to be tailored around your lifestyle and your particular needs and what your goals are. Kind of a lot to unpack in just less than 20 minutes, but being in the military kept you in shape, kept you doing PT in the mornings, kept you carrying stuff and moving around. But staying healthy after service requires a much more deliberate approach. And these conditions are, one, treatable, many done early enough without medication. It can improve your mood and can improve kind of your overall quality of life. I know certainly on active duty, coming from some of the organizations I was a part of, you don't really get to say no. You can't really, you kind of have to push through the pain and whatever else, all that kind of stuff. But these conditions develop slowly. The metabolic syndrome is insidious, and it only gets worse over time. So the sooner you can get a hold of this and get control of your life and your health, the better it will be for you, and the healthier you will age, and ideally age gracefully and well, and be a very be a fit person as an older adult who doesn't need to depend on others to take care of themselves. Okay, this concludes this week's episode. I hope this was helpful to you. I want to encourage you all, like I said, pick something and stick with it. Try it. It's not easy trying to get all this stuff done at once, but encourage you all to be well.